One of the factors that determines a person's professional growth is how exposed and connected he is in the niche. Today, we are at International Critical Care Organ Donation and Transplant Conference organized by the Emirates Health Service. And now I have with me Dr. Issam Al Zarooni, who is the Executive Director of Medical Services in the Emirates Health Service. I welcome you to the show, sir.
Thank you.
Can you give us an overview of Emirates Health Service and its role in UAE's healthcare system?
Thank you for hosting me first. EHS or Emirate Health Services is the operator arm of the federal government. We operate the federal facilities in the Northern Emirates. We have around 134 facilities. That includes hospitals, primary healthcare centers, public health centers. We serve around 5 million visits, 1 million patients almost per annum, annually. And as such, we are we play a big role in the health of the community of UAE, in particular in the Northern Emirates.
Next, I would jump to how does EHS, that is Emirates Health Service, contribute to advancing medical services and patient care across the country and the world?
We use the patient-centric model in providing the services to our patient population or the population in general in Northern Emirates, all the way from preventive programs across the age groups and across the geographical areas to the most advanced high-edge technological based services or specialties. We highly focused now on adopting the new technology into providing safe care with high quality, but at the same time efficient enough so that it sustains long. We, of course, are very keen into involving and engaging community into empowering them to take care of themselves, because this is the era now. We no longer want to treat people after they get the disease. We want them to be in charge of their own health so that they don't get the disease if possible. And if it is not possible to get disease, at least we prolong it enough so that they have a better quality of life overall.
So, what I understood is it's community centered, and we make sure that prevention is better than cures. Before getting the disease, EHS make sure they have the necessary knowledge about that particular thing so that it's barricaded in.
That's all that. Exactly. I mean, we have facilities for providing the treatment and the care, but the whole health as a concept is not related to treating diseases. The focus is now highly on preventing the disease if possible, and then the new thing is to empowering people to take care of their own health by providing them with the data they need, whether it's through screening programs, through precision medicine, through genomes, and so on, so that they know what they should do, how they should do it, when they should do it, so that they have a healthier life and they don't go into getting the diseases, or at least we prolong it as much as possible.
What are some of the recent initiatives or projects by EHS that are transforming healthcare in the whole of UAE?
Yeah, of course, we have many initiatives that mainly based on providing efficient care with high quality and considering the patient safety. One of the things I can tell you about is that we recently launched what we call e-rapid care, which means patients can log into our website and app and ask for the service. Somebody will screen them to see if they are a true emergency case and then direct them to the nearest emergencies. Otherwise, there will be somebody on the other line who can see them, evaluate them, and if they seem to be stable enough, they don't need to go to the hospital. They can provide them with the guidance and advice and medication if needed. Otherwise, they can direct them to either one of the PHC centers or one of the hospitals according to the case. So this is very new thing for us. And we hope that with time, the care will be more or less digital or virtual. And the emergency is an area where we want to focus on in the near future, because that's where a heavy demand is from the patient population.
I would like to know how well penetrated this particular program is within the community, and has the community accepted it to the core? Is it still being?
It's still in the early stages, but it has been launched successfully, and people are using it. And of course, adopting anything new, especially the virtual care, will take probably some time till the community get used to it. They know how to, approach it, what you do, and what's the best way of dealing with it, and so on. But it is one of the promising projects that we hope will manage or deal with many of the issues that we have around providing urgent care or emergency care.
That's great. I understood how EHS is integrating technology and innovation. Do you think in the near future it will be a major domain to work with the data that we have, es- especially with AI coming to the forefront? And do you think that would take the major leap?
Yes, as you know, UAE, under our great leaders and their leadership vision or visionary leadership, want to be upfront and leading the world in adopting the new technology. As such, we had the first minister of artificial intelligence. We have CEOs in each governmental entity, and us as the EHS, part of that strategy, have our own plan and strategy on how to adopt technology, and AI is one of them, into our service and providing the services. Now, doing so, there are many aspects that you can use. There is the screening, preventive part, there is the diagnostic part, and then there is the therapeutic part. In each one of these, we have our own initiatives that we hope that it will reshape the way you provide the care over the next 5 to 10 years. Of course, these are all new, but in EHS, we are very open to all of the new solutions that are available. We are very agile and flexible in adopting them. We have a very well trained and flexible healthcare worker who are easily adjustable to the new changes. And we hope that this will help a lot in uh, improving the quality of care provided to our patient population or to our population in general, and at the same time helps in efficiency and sustainability over the long run, as being one of the goals of the country and us as the AHF.
I understood from your talk that EHS is very community centered and is trying to be the forerunner in technological collaboration. That is from EHS. I would like to understand or the advice that you would give to the community as laymen, how we can contribute better to EHS or healthcare in general. The advice that we have.
I think the community will help us a lot by in engaging in the preventive and screening campaign that we have, getting the knowledge on how they can control their own health, and as such, help us in preventing the diseases. It is very important that they use the services that are not only therapeutic, because I think people are used to I get sick and then I go and then somebody would treat me. We don't want that anymore. We want people to say, I am healthy now, but what are the things I should do so that I don't get any diseases? And there are many tools that we can use in terms of screening, even knowing the gene behind certain diseases, and as such, provide this to the community. So they will have a huge role in helping us, serving them in a better way. The other thing I think it's very important is for the community to understand where to go when it comes to level of cares. Many people put a huge pressure on the emergency department, while actually there might be much better service and can be provided in a more sophisticated if you go to primary health centers, for example. So we want people to be using primary health centers, preventive health centers, preventive programs, rather than going and putting a pressure on the emergency department that should be left for those unfortunate patients who have true emergencies.
I understand that quite well. You told about the role of community. Before winding up our podcast or our ability report, I would like to understand how can the community reach EHS? What are the channels that you have? The primary healthcare center, the social handles, whatever it is.
Okay, so EHS has an application that they can use. We have a website that they can use. And of course, we have our facilities. We are also on the social media. We try to keep the public aware of our initiatives, of our programs, especially when there are new things, and engage them into first designing these programs with us, and then once it is there and how they can use it, and then get feedback from them on how to enhance it. And then the government has a very effective tool through engaging the patients and our population into giving feedback around the services that we provide, and we use those actually to enhance our services and improve with time.
We have got enough information about EHS and its services. So I'd like our audience to know where to connect, and we will be putting down the social handles as well in the description below. So it was an honor. It was truly an honor to have some insights from you, Dr. Issam. Thank you for being on the podcast. I wish you all the success in all the future projects that EHS will be taking forward. Thank you very much, sir.
Thank you very much, and we wish that everybody who lives in UAE lives a healthy life and enjoy the life in a healthy way. And we wish that we don't see people in our facilities if possible, and if not possible, then they get the best care that can be provided.
Yes, thank you. Thank you very much.